Good morning. It's Dr. Jeffreys again on Thy Precious Jewels Health Talk. This morning I'll be continuing on the talk about cervical screening and cervical cancer. The cervix is a hidden part of the woman's body, but at the same time can cause a lot of trouble. Cervical cancer is a preventable disease in a lot of people. Today I'll be talking about how women put themselves at risk of developing cervical cancer and how you can manage the risk. For majority of women who will develop cervical cancer in their lives, it's because of the changes that I explained yesterday. The changes that happen to the cells of the cervix. These changes can be caused by a particular virus called HPV. If you have been infected with the HPV virus, the type that can lead to cancer, it's only a matter of time before the cells of the cervix start to change. Once the change starts, it can take a few years for you to actually develop the cancer. During these few years, if you have a cervical smear test done, they will be able to pick the virus through the test. They will be able to treat you. And if the cervix is so badly damaged as a result of this, they may even be able to take the cervix off before it leads to cancer. How do you come about the HPV infection? HPV infection can be caught through sexual intercourse. That is the reason why we do say to women, if you have never been sexually active in your life, the likelihood of developing cervical cancer is very small. Once you have had the infection, or once you've had sex with somebody who has the infection, it can remain quiet without any symptoms at all. Some people may notice that they have flesh-like growth down below. These growths are called warts. Usually warts can be managed. They can be really difficult, but they can be managed. If you find that you've got abnormal growths down below, then you do need to get checked, and your doctor will be able to tell you whether they are warts or not. If you do smoke, you put yourself at a higher risk of having cervical cancer. If your immunity is low for whatever reason, either because you're having treatment for cancer or you're on long-term medications that lower your immunity, then that will make you a bit more prone to cervical cancer than the rest of the population. In the past, it used to be said that a woman who starts sexual intercourse very early in life could have a higher chance of having cervical cancer. However, it has been proven nowadays that it's not just the fact that they've had sex for a long time in their life. It's probably the fact that when they start at an early age, they're not looking out for the kind of infections that will put them at risk of having a cervical cancer. Going for a smear test can actually save your life because the doctors are able to pick the abnormal cells out really early, and they're able to give you the treatment that is needed. Usually the treatment is what I described earlier on. They would have a closer look at your cervix. They will be able to see where the bad cells are, and they will be able to remove the bad cells. If the cells are badly damaged to the point that they are nearing development into cancer, then the whole of the cervix can be treated either by being frozen off totally or by being removed. It is only in severe cases that this is needed. Most women are just okay with a minimal treatment, and then the doctors will keep an eye on them for a few years to come. If you don't go for a smear test, you wouldn't know whether yours was normal, slightly abnormal, moderately abnormal, very abnormal, or dangerous. I'll advise you, if you're listening to the sound of my voice, if you're 25 years and above, please book an appointment with a doctor. Let them do a cervical smear test on you. After all, if it's negative, you don't have anything to worry about for the next few years. Would you like to pass this across to your friends? You don't know whose life you may be saving. Thank you for listening to me today. If you do have any questions about what you have heard and what you have seen on our health talks, please drop us an email. The email address is thypreciousjewels@googlemail.com, and we will reply you. Once again, it's Dr. Jeffreys on Thy Precious Jewels Health Talk. Good morning.